my life.
Oh! A deviant border collie, misguided cartoons, and wild medical scenes? Huh? Today we're reacting to Mr. Pickles, a show that I am told will leave your jaws wide open in disbelief. Let's dive right in.
Would you just die already?
What the heck? What the heck is this doctor saying? The person's got 3 IV bags going, which in my brain, there's multiple different medications. And he's got the old school paddles on there, and he's stacking his shocks, which we don't do. You're doing one. You shock the patient, and then you continue CPR immediately.
Huh? Quiet.
Sometimes there's dogs in a hospital, therapy dogs. Otherwise, it's really not that sanitary. Having an animal walking around the hospital.
Here, every dog loves hot dogs.
Oh! What? What the heck did I just see? Taking off his hair to wear it as his own wig. You can potentially do that. You're gonna have a lot of bleeding. You have a lot of blood vessels in the face and on the forehead.
Oh, you want a quickie?
Oh my gosh. Looks like he's in the morgue. There's a morgue in every hospital. So when somebody dies, they go down to the morgue and they're either waiting for a medical examiner or a funeral home to pick them up or somebody to claim the body. Oh! Our faces don't peel off that easy, but the muscles are cool around the mouth. It actually looks pretty good. We're missing a lot of different muscles.
Please help me, Mr. Pickles.
A lot of times when you fracture something, the bone will actually poke out of the skin and then retract. That needs to be taken to the operating room because now you have had bacteria that now is seeding back into the bone, and then you actually end up having to be on antibiotics by IV infusion for 6 to 8 weeks.
Oh, good boy. Wait.
Oh, what the hell is this? This dog is messed up.
What is wrong with this dog?
Would that actually happen? Probably not. Fall would probably kill him versus smashing somebody in the face like that.
Hey, did you know medical waste is good for the environment?
What?
Stop pulling my leg.
We have people that come to the emergency department when they actually step on a needle. You never know. Could there be an infection on it? Do you have to do prophylaxis for HIV, hepatitis?
Hey, quit chewing up my shoe, dog!
Well, at least the dog now is doing some good service. That significant amount of rotation. The concern is having a high fracture, which then causes a spinal cord injury. Cervical areas 3, 4, and 5 have to do with your diaphragm. So if you lose that, you have no ability to move the muscle to help you breathe. That's when you actually need mechanical ventilation or you won't be able to survive.
Hey, stop pulling
Holy cow, he just pulled out what appears to be his tibia. You have a couple bones to bite through before you can get to that, but he ripped it out and then did what every dog classically does, to try to hide and bury the bone.
Our x-rays show that you have several items in your rectum.
What? Okay, so this actually is very common where people place things in their rectum. People don't realize that our body is basically negative pressure. So once it crosses a certain distance, the negative pressure of our body sucks it in.
One slinky, no, part of a guitar, one roller skate.
So typically, if you're going that intense to get something out, you actually sedate them. Sometimes you can actually do things without sedation if it's super easy, but it looks like they're beyond the wrist in there. Yes, you want to be sedated.
I have to get all the way in there.
Oh, please!
One empty jar of pickles, and let's take lunch, everybody.
What?
No, you would never ditch the patient. You'd actually have another doctor come in if you needed a break. Patients tell us all the time that they fell on it.
I fell on it.
You don't fall on these objects. We're at a game. Oh! People get hit a lot. You always worry about nasal fractures. First thing you do when you get a nosebleed, you just pinch and lean forward versus leaning back because you'll get a bunch of blood that goes back to your throat. You might swallow it, get nauseous, and vomit, so you don't want to deal with that. Oh! I have seen people get hooks stuck in their face. What we actually end up doing is you cut the end and then you actually push the rest of the fishing hook all the way through.
There's no American cheese at it.
Why is it getting cheesed?
Melted into his skin. Bad into the lake. Never to be seen again.
A lot of times we actually deal with people who get burn injuries, hot water, hot oil. Like sometimes food, if it sits on there too long, it's just gonna cook the tissue. And then you always have to worry about getting it off, which is extremely painful. What the hell? Again, the intestines come out this big long string. It's not like that in our body. It's actually all attached by mesentery, and that's where the blood supply gets to the intestines.
Dragged a nice lady behind a dumpster, scalped her, cut off her leg to use his stilts.
What is up with this dog? This dog wants to be like a human being. We can see there that the femur is just sticking out. We actually have to be really careful when we have fractures that come to the ED because the bones are actually so sharp. What? Rats harbor lots of disease. There's a big debate on bubonic plague if it's related to rodents, rats, versus like fleas and ticks. If there's a lot of rats and rodents around, it's poor living conditions, which then increases the risk of having a lot of fleas around, thus relating to having issues with black plague or bubonic plague. Oh! You don't have that much blood down in that area. Your major blood vessel is your aorta, but then branches off and then goes down to each leg.
The Pickles in a doctor's man. He started cutting people up with a chainsaw. No! He put human heads on his paws and started dancing.
I've seen chainsaw injuries at the hospital. You're worried about the muscles that are underneath, the bone that's underneath. There's a lot of things that you need to kind of reattach. The fact that a dog can actually use a chainsaw, we won't even get into that.
Oh, I hate my leg braces.
Nobody's perfect. I have a thumb growing out of my belly button.
Wow.
That doesn't stop me from being happy.
Oh my gosh! Sometimes people have a defect called a gastroschisis. Your abdominal contents are actually coming through the belly button. It's also another site of very common hernias. There's not really much muscle there to prevent contents from coming out. What the hell?
There you are, boy. Come on.
Oh man! There's 6 muscles that attach to the eye, plus the optic nerve that's in the back. So you're gonna have 7 things kind of dangling there.
Where are you going?
Oh! Rib cage, sternum, they're all here to protect our vital organs. Lungs, plus the heart, your esophagus is behind there. But somehow the dog's able to break through.
There's no dogs allowed!
We'll see people who have like stab wounds to the head and the face. Most of the time, they actually just hit the soft tissue and bounce off because it's really hard to get a knife stabbed through bone.
There he is!
The meat cleaver is almost like an axe that you can actually get into the bone. So that's a little bit different than a knife. This was a little nuts, okay? I have to say, I don't understand why a border collie, Mr. Pickles, is going crazy, causing all this mayhem and injury. But I hopefully gave you guys some insight and dissected out some of the medical components that would be relevant to what I do on a daily basis. So if you enjoy this, check out this playlist right here. And as always, make sure you subscribe, turn those bell notifications on, hit that like button. I appreciate you guys watching. Thank you so much and stay healthy, my friends.